Hello, everybody, and thank you for joining us on this Monday lunchtime. I hope that you've had a good Monday so far. Not always the easiest start to the week, but I'm hoping this will be interesting and engaging, and hopefully give you a bit of a boost for this afternoon to get you through the rest of the day. I'm Jo Stanford, and I head up the Healthcare Project and Change Association. Today we are talking about pirate movement and ninja stealth. So understanding neuroscience for leading change. There will be feedback polls at the end of the session that we would really value your input, because if you can provide us with your feedback, it can ensure that we deliver the content that meets your needs going forward. And we always look at it and make sure that we make best use of it, and it helps us steer the direction going forward. If you haven't already subscribed to the HPCA, it is free and it'll help you keep updated with what's available to support you and your teams, including events like this and ones that are coming up, including Peter's, which is tomorrow and Wednesday. So don't forget to subscribe. We'll send you more details about those specific events later on, so don't miss out. If you haven't already, please do introduce yourself in the chat, who you are, what role you do, and where you work, and make the most of this opportunity to connect and network. And if we've got anybody that was from the King's Fund Summit here that connected with us at that event, let me know in the chat, because it'd be great to see if people have come from that and then joined up and followed up from that session here. Without further ado, what we'll do is we'll get started, because as I said, there's quite a bit to talk about. What we'll do is I'll cover the topic around this particular one. We'll have a Q&A at the end, and then there'll be a bit of an update in terms of what's going on and things that are coming up that you might want to be interested in. Okay, so let's get started. So why do we talk about project movement and ninja stealth, and why is that critical in terms of understanding neuroscience for leading change? So for those of you that were at the King's Fund Workforce Summit, you'll recognise this picture, and some of the others that have been to previous events might do too. Bit of backstory: I'm a project, programme and portfolio professional with 20 years experience working in the healthcare sector, and I became dissatisfied with the outcomes being achieved across the sector in terms of the outcomes from projects and change, how we are delivering impact, how we're making a difference. There's a lot of projects going on and not always achieving the benefits. I became dissatisfied with the outcomes, and I wanted to see what we could do to improve project and change capability and standards so that we get the better outcomes for patients. And so part of that was setting up the Healthcare Project and Change Association, so we can support the development of standards and capability across the healthcare sector. Now, for those of you that aren't familiar with this, this is a picture of shadow of K2, the mountain across the range. And some of you may have heard the statistics that 70% of projects fail. And if 70% of projects fail, what's going wrong? What's consistently not happening or happening that is impacting on those outcomes? And the reason we pick this particular analogy is that of those people that attempt to climb K2, 33% of them fail. And in their case, it means that they die in the attempt. So why do people climb K2? If you can stick your thoughts in the chat, why do you think people climb K2? Let's see what you think about this. What's the purpose of it? Who's got an idea? Why would you climb K2? To say they've done it, yes. To change body and mind, personal achievement, adrenaline, yeah, think they're stronger for the challenge. Because it's there, yes. It's a very human trait, isn't it, Sue? That if something is there, we must climb it. Absolutely. Personal goal. One of the things about having these kinds of challenges in life, or having these kind of sense of purpose and things that we must do, is making sure we're clear about the outcomes and whether or not we're going to achieve those outcomes. So many people talk about, getting to the top, standing on the summit. We've seen so many pictures of people with their flags, standing at the summit for that 5 minutes that they're up there, going, woohoo, we made it, we're here. And most people put their time and energy and effort into hitting that target. But if I told you that 90% of the people who die on K2 die on the way down, would that change your perception about what the aim of it is? Because all you're trying to do is get to the top, and you manage that, but you fail to invest the time and energy and effort to get down again safely, you're not going to achieve the benefits. And for me, this is kind of symbolic of the way in which a lot of projects are delivered in the healthcare sector. We are very target focused. We're very much, we must hit the top of that mountain. We must hit that target. And we probably, most of us have been involved in those in our working lives, whether it's 4,200 more health visitors, 50,000 nurses, 6,000 GPs. There's always a critical target to be aimed at because those are put in front of us. We must do this thing. But if we only focus on that thing and we don't look at what's the consequential impact of that change on the system, and also how do we ensure that we embed it and we make that difference stick and that it's sustainable, we fail to achieve the outcomes and nobody benefits. And often there's a graveyard of projects that die along the way. So how can we affect this? How can we do things differently? So if we look at project and change management and what does that mean, I just want to do a little bit of a recap for those that it might not be their primary profession and it's something that they want to learn more about. So if we're looking at building project and change capability, one of the things that we need to look at, well, what are we talking about when we talk about projects and change? So project is generally considered the planning, the activity, the development of things. So they might be a new IT system, it might be a new process, a new policy, a new way of working, a new thing that we have to implement. The change management piece is about how we take people on that journey with us and take them and get them safely to the other side. And the other side being the new way of working or the new process or the new system that we're using that means that we've got something better than we had beforehand. The thing about people climbing K2, you might think, well, actually, there's the thing about actually climbing it and that moment of experience, but it's also how you carry that experience with you going forward. That's the benefit. That's the bit that takes you to the next level of your life. And in the same way that projects and change are, if you think of getting to the top of the mountain being the project, getting down again safely is the change management bit. It's about how we make use of that learning, that new experience, and it enriches our lives and makes things better. And so that's some of the things that we need to think about and look at. And what do we do in the context of supporting that stage in learning? Because very much when projects are delivered, they've gone, ta-da, we put it out there, we launched it, we made it available to people. And they go, right, that's my job done, off I go, start the next one. But if we haven't got the change management in place that says, and who is engaging the workforce and the teams in this new way of working? Who's getting them involved in the design to make sure it's fit for purpose and does what it's supposed to do when it's implemented? Who's actually working inside those teams, supporting them with translating what's coming out and saying, right, how are we going to do this here? And also the investment in training and effort to make that happen. Because you'll know from experience that when you are actually changing the way in which you do something, it requires a lot of concentration and effort. And this is where some of the understanding around neuroscience from the change management point comes in and becomes really critical. We've got the project and change methodologies, we've got the kind of processes, but what we're missing in this model is the human factor. It's understanding what goes on in people's heads when they're presented with change and when we try and engage them with it, and understanding how we can ensure that we take them on that journey more effectively. If we've got any neuroscientists on the call, please feel free to correct me at any point by putting your notes in the chat and add any information that you think would be valuable for people to look at in more detail. I'm not a neuroscientist, I'm a project and change professional that's learned about neuroscience so that we can bring some of that learning into what we do to improve how we do it more effectively in partnership with the neuroscientists. So what are we talking about when we talk about neuroscience and how we are looking to change the way in which people think, and believe and behave as a consequence of doing something new and different. There's three key elements to it. One is around neuroplasticity. And there's an old adage which is you can't teach an old dog new tricks. Well, it turns out you can, but the older you get, the more incentive you need to be able to build new neural pathways. It takes a little bit more effort, but actually you can teach an old dog new tricks. And there's a really good example where the National Trust, which is almost entirely managed by volunteers, and often people who have time on their hands in order to do that volunteering, and that means they're often retired. They brought in new technology, they brought in new tills, so, you know, scanning everything, automatic things, automatic payments, all of that kind of stuff. And the way in which they made it more accessible to them, because they didn't want to make them fearful of this new technology, was they had tea parties. They had tea parties, got the volunteers together, and they had cake, tea and cake. And you know those cakes that you can have pictures printed on them? They had pictures of the new technology, the new, you know, tills and things printed on the cake. They didn't talk about that. They just sat and ate tea and cake and talked about how important it was for them to be part of this process and support the future of the National Trust and saving things for future generations. And what that did very subtly was it got them de-fearing the idea of engaging with the technology. And those who were a little more technology minded, they became the champions and supported others to learn. So you can build new pathways, you can teach people to do new things, but you have to create the positive environment for it. And that's where the brain chemistry comes in. We'll do more about this because this is really the kind of crux of it. This is about how you create positive brain chemistry to get people thinking and creatively engaging with you on that change to get them on the journey. And when we talk about waves and wavelengths, this is about frequencies of states of being and thinking. And this can enhance creativity and switch from a constant churn of doing activities to be able to engage and think positively and creatively and set time aside to be able to make that happen. We're not going to focus on that bit in this one, but it's something in future if people are interested in neuroscience. So when we're focusing on brain chemistry, what are we talking about? So I want to conduct an experiment with you all. So let me just switch screens so I can see who's here. So what I'd like you all to do, those that have got your cameras on and everybody else that we can't see, is I want you to close your eyes. And I want you to think about, take a deep breath in and slowly let it out. And I want you to take some slow, long breaths, and I want you to think about the happiest moment of your life. And thinking about it, I want you to imagine what it looks like. What are the sounds that you can hear? What are the scents? Who are you with? What are you touching? What does it feel like? And just immerse yourself in that moment and bring that back to the front of your mind. And think about what was the wonderful thing about that and how did that make you feel? Okay, and open your eyes. In the chat, tell me how that made you feel. What does that feel like to go back? What's the sensations in your body when you take a deep breath and you go back to something that's a happy memory in your mind? What does that feel like to you? Calm. That's lovely, isn't it? Warm, peaceful, relaxed, content, fulfilled, joyful. Awesome. Calm and safe. Fuzzy happiness. Lovely. Fulfillment, wholeness, peacefulness. Isn't that an amazing bunch of feelings to be able to generate? Do you know what the amazing thing is? We're still at work on a Monday lunchtime, and yet you were able to create those feelings just by bringing back that memory. And this is a really important point about neuroscience and the way in which the brain thinks and works. Because the brain cannot tell the difference between fantasy and reality, or memory and what's happening in the moment. So if you bring up something that is a happy memory, that you reconnect with something that generated all of these positive sensations in your body, and it makes you feel calm, makes you feel relaxed, your brain is producing positive brain chemistry. It's flooding your body with endorphins and oxytocin, and it just feels good. And this is really critical to learning about how to engage people with change when we look at it from a neuroscience point of view. So just now that everybody's in a happy place, when we look at what's going on in the brain, we are ultimately, very kind of basic animals. We might have iPhones, but frankly, everything else is pretty much the same as it's been for the last several 100,000 years. And the brain is the same. So it can't tell the difference between a physical threat and a psychological threat. We're still programmed to run away or hide or freeze when we feel physically or psychologically threatened. When we get the hint of a threat that something bad's going to happen, our amygdala kicks in and it shuts off our cognitive brain and floods our bodies with adrenaline and cortisol to give us that burst of energy we need to survive. The problem is when you're working and in an environment where we work, where we're not physically threatened, having that burst of adrenaline and cortisol can be very painful, very uncomfortable. And what we need to do is, how do we support people through change without getting them into a state where they're feeling anxious and stressed? So if you think about how often you feel stressed at work, how often you feel a sense of anxiety, you feel, the adrenaline rushing through your body and your heart rate pounding, it's generally not because somebody is threatening you. There might be the odd occasion, but it's hopefully not the norm. But it's because something is happening in your work environment that feels like it's a threat to how you do things or the way you do things or what you do in your work. And that is where the body is still working in the same way that it did when it was running away from, saber-toothed tigers. So how do we present change so that it doesn't trigger that fight or flight mechanism? And how do we get people engaging in a positive way? We plan it really carefully as the starting point. Once you've triggered the amygdala and people have got that the thinking brain switched off and the adrenaline running, it's really hard to switch that off and get them back into a calm and relaxed state in order to get them thinking creatively and cognitively about what's happening. But one thing you really need to understand about change is change requires energy. Say you move from working in one hospital to another hospital and you drive to work every day, and you used to do it by autopilot. You just get there, your mind would be on all sorts of things. And then you need to concentrate, because if you're going to a new hospital or a new building, you need to really focus on that, on what's around you, which way you're going, which direction are you going in, until it becomes the new habit. Because otherwise you can find yourself heading in the old direction because you won't concentrate. Your autopilot has a stronger neural pathway for the old direction than it does for the new. And so you need to practice that, and you need to be conscious of it until it becomes a stronger neural pathway than the old one, and it's now your new autopilot. That's where we need to get people to in order to embed change successfully. But it takes effort and it takes energy. And the thing about the brain is the brain uses 20% of the body's energy. And therefore, if you have people who are overloaded with work and they're drained and they're busy the whole time and they haven't got time to stop and think, telling them that there's a change coming along and that's okay, we'll teach you how to do stuff, it'll be a change to the way we work and do things, that is going to be perceived as a threat because they're thinking, I don't have the brain energy to be able to cope with this. So how do we work with people on this? So what we do is we look at things like changes of processes, ways of working, new IT systems, in exactly the same way as we would if there was a potential threat out there that require brain energy and concentration to enable us to learn and practice them until they become the new normal. So how do we do that? Well, the first thing is to think about what can we do to save energy. If we need people to have space and time and energy to be able to think about learning or doing something new or different, We have to create the environment for it. We have to make sure that there is space and time to enable them to switch off from that frantic doing activity to get into a creative and positive mindset to learn in a way that goes, okay, this is going to be good, this is going to add value. Pattern recognition and familiarity. That's all about making what you're doing look and feel similar to what they used to do. Because if they recognize it and go, oh, that's just like when we did this. Okay, yeah, I get that. They have a mental map for it that allows them to engage with it much more easily than if you present them with something that they have no frame of reference for. One of the things about frame of reference, if you don't understand it and you don't get it, it becomes more of a challenge because you don't know how to engage with it. So pattern recognition and familiarity, really important. And the bit in there about hunting and laughing, it's about making it fun. It's about like the National Trust going, we're not going to talk about tills and new technology, new ways of working. We're going to have tea and cake, and who doesn't love that? And we're going to sit around and chat to talk about how awesome the National Trust is and why we love volunteering for it. That's the dynamic you wanted to create that gets people into a state where they're excited and collaborative and they're trusting you to take them on a journey in a positive way. They're open to new ideas, they're motivated, and hopefully they're open then to learning and being able to engage with this new way of doing things. So how do we go about doing some of this? Let me just take a pause there and make sure everybody's on the same page. So when we look at change, we often get hit, and I mean hit, with really big organizational change. It disrupts everything. It disrupts ways of working, it disrupts teams, it disrupts the patterns, the connections, the relationships that we have. One of the things about change that is really negative is when we do all of these big complex changes and we still fail to achieve the outcomes. Why do we always have to go for these big complex changes? Are there not ways to look at what outcomes we're trying to achieve and put the minimum amount of change in place in order to get that outcome that we want? It doesn't always have to be a big bang. Is everybody familiar with the phrase quantum leap? It was a quantum leap in terms of, this new thing we were doing. Well, the thing about a quantum leap from a physicist's point of view, a quantum leap is the smallest amount of change that you can make to move from one state to the next. It's the tiniest increment that tips it over into the next level. And that's the kind of change we want. Not some big complex change. It's about the subtlety of change. The best changes in the world are the ones that you didn't know were happening, because it didn't disrupt what you were doing. It didn't change how things were working. Now, I'm not to say that's always going to be possible, but actually part of our planning has to be, how can we make this as least disruptive as possible? And this is where the change ninja kind of philosophy comes in. So we have some training that Dr. Tammy Watchorn delivers for us on the change ninja approach to things. And if nothing else, have a look at her book, because it's fantastic. It's an interactive adventure, so it's fun whilst you're learning about the consequences of decisions that are made during change. But the thing about being effective and delivering change effectively is being the least disruptive. And that's about being able to flex change in and try and adapt the way you do things in the least disruptive way possible. But in order to do that, we have to start with the environment we're working in and making sure that it is seamless and painless. We need to start with ourselves and our teams, ensuring that we have the right knowledge, skills, and capabilities to lead the change effectively. Do we have the right skills? Do we have the right people on the team? Have we got the right mindset to be able to approach this change? We then need to look at the organisation and ensure that it is fit for the change. And we talk about change readiness, but who really does that to any great extent and assesses it? Because we need the organisation to have that capacity to be able to engage with the change. And if you can't do that, then you shouldn't be doing the change, because you're not in a fit position, and it's going to create more damage than it's going to create good. Amy Edmondson, you may all be familiar with her, but she does some fantastic work. You've probably heard of the Fearless Organisation around creating psychological safety in the workplace for learning, innovation and growth. And also the teaming. There's a bunch of teaming ones, and Teaming to Innovate is one of many in that collection. But the point about it is, it's about starting with solid foundations, both for you and the team that are managing and leading the change, but also the organisation that you are implementing that change into, or a complex series of organisations if you're looking at it from an ICS perspective. The thing about being able to be ready for change is how do you assess it, and then also how do you ensure that people have the right skills to be able to do it. So one of the things about this is it's looking about getting the team in the right state, but also making sure that they have the skills and competencies, getting that training in place. Creating the right environment for change, creating the psychological safety where it's okay to speak up, to say, I don't think this is going to work, this isn't landing well, this isn't delivering the outcomes we thought it would, we've got some feedback and resistance, we've got some struggles that we need to factor in. Building trust and openness and collaboration is a solid foundation of which to then present some of this change. We don't have time to go into a lot of these in depth, but I think it's useful to have a broad brush of some of the things that you can bring in when you're looking at that change planning process. So as well as developing the team and the organization in terms of its resilience and its state readiness for change, we then need to look at how we coordinate people around that change. And this isn't about hierarchies, this is about mindset and engagement. So the other thing I'd like to introduce you to is how to be more pirate. And the thing about pirates, and people may not be familiar, so the quote from Steve Jobs, I'd rather be a pirate than join the Navy. And this is really about a mindset thing, which is about collaboration, it's about innovation, it's about creativity. But also, you may or may not be familiar with how to be more pirate or be more pirate, but the golden age of piracy had a pirate code. And the people who joined the pirate crews were generally people who were disenfranchised with the Navy, because that was an incredibly harsh place to work. And also, the benefits weren't being received by you. There wasn't equity, there wasn't equality, and yet there was within the pirate domain, because they created the environment that they wanted to live within, with the values that went with it. So some of this is about looking at how you create a positive movement for change. And it's off topic, but in terms of the pirate code, they had gay marriage in the pirate world. They had equal opportunities from a gender point of view. They had health insurance. So if you were injured, you got paid out. So you weren't left destitute, which you were if you were in the Navy. And they would also repurpose people. And the other thing was nobody earned more than 4 times more than anybody else. And the captain, if they weren't good at their job, was voted out, and rather cruelly, if they didn't do a good job. So it was a collaborative, it was about a shared sense of values and mission. And so the thing about having that shared sense of values and mission is you're bringing people together around a joint sense of purpose. Why are we here? What are we here to do? Whose life are we trying to make different? And this is about focusing on the outcomes and looking at what you, scrolled the wrong thing. Looking at what you can do to take people on that destination journey. Where are we trying to get to? What does it look like? What's the outcome we want to achieve? What's the destination we want to bring everybody to? And how are we going to take them with us on the way? And some of the principles of that is about how do we ensure that we're taking our members with us, and how do we get them to go on that journey? So this is about mindset and a sense of values that underpins this approach to change management, and how you bring people with you. But in terms of practical tools and how we get people to come with us on that journey, there's some really great stuff in John Kotter's work, and you're probably familiar with his 8 steps model for change. But there's also work that he's done called Accelerate. And I really like this model because it goes along with the pirate theme, because it's about building advocates, allies, and ambassadors to engage with that change. It's getting people to go on that change journey with you. And that's getting people to say, oh, yes, I work for this department or this function. And yeah, I'd be interested in that. I've got something to contribute. So it goes 2 ways. You want to recruit people from the different teams and functions, because you need to understand what's happening in their space, understand how it will impact them, get their input into designing it, and also helping to shape how it gets rolled out and embedded. But also it's about making sure that people who are contributing to it know what you're doing, how you're doing it, and that you build trust and a relationship with them. Damn it, done it again. Sorry. So how do we keep this on track? So we've got the hierarchy, and there's always going to be that organizational structure. So you're going to need to have, you know, a business case. It's going to have approval. It's going to be, you know, corporate messages, all of that stuff. But that's not necessarily the relationship bit, and that's where the network or the guiding coalition comes in. Because the guiding coalition can bring people together from across the landscape, agnostic of their status or their responsibility, but they can bring insights, they can bring intelligence, they can bring thoughts and ideas and solutions to how you can do some of this stuff, and make sure that where they are going to be working, it is fit for purpose. And that's really important when you're looking to embed and implement change, is that what you're offering is going to work in their context, and they know and understand that, and can help those in their teams to go on that journey and help to take them through that painful process of learning how to do something different. So how do we track the individuals and the teams and how they are coping with the change? And this is a critical element. So we've got how we support ourselves with the approach around creating psychological safety and team development. We've got a model for how you coordinate people to engage with the change. So how do we keep track of those people and where they are on that change journey? And many of you will probably be very familiar with the Kubler-Ross change curve that was around grief. And this is my favorite version of it, because I love all the people and all the different states they're in. And the change curve is really important for understanding and engaging with our teams and our workforce to understand where they are on the pathway. And people will move back and forth. Some people will be like, change, I love that, that's great, and gallop off into the future. And others will be like, I don't understand it. I'm very comfortable with what I do now. This is frightening, or I feel out of my comfort zone, or it makes me feel vulnerable because I'm not an expert anymore because you're telling me to do something that I don't know how to do. And so being able to assess where people are on that change curve, and also put plans in place to hopefully help them through some of those emotional changes and difficulties they're going to face, will hopefully mean that you don't end up with people in the pit of despair. Because I think once people get into a negative place, then it becomes very self-destructive. It's very hard for them to get out of it. We've probably all been there with organisational change, where we feel disempowered, we don't feel like we've got any control, we're scared of what's going to happen. Am I going to lose my job? Am I going to end up in a team or in a function that I'm not familiar with or don't like? And all of that can be very energy draining, but also really quite depressing. So part of the thinking and planning around taking people on change is understanding that people will go through some of this process, but how can you shortcut it? How can you make that it's not that painful and that it's not impacting on them negatively? And the great thing about having the model where you've got the coalition, where you've got people in the different teams and functions, is they can keep an eye out for how people are doing. They can look up whether or not they are engaging, are they withdrawing, are they off sick, are they struggling with it, and have those conversations and do what they can to support them, because we want to take everybody on this journey. So how do we plan for the change then? How do we make sure that we've got a process and way of taking people on that journey once we've got the insights and ability to assess where people are? And there's a number of models out there in terms of taking people on change, but I really like the ADKAR model, so from ProSci. And this is about how you plan to take people on the stages of development. So awareness, this is about making people aware that something is going on. And there's always a bit of a dilemma that people face in terms of how soon do we tell people that some kind of change is coming. If we don't tell them soon enough, the rumour mill will get out, and then there'll be all sorts of, conspiracy theories about all the terrible things that may or may not happen. The flip side is that we tell people something's happening, but we haven't even started thinking about how we're going to do all of this yet. So you spend months telling them you don't know. But people assume you know, because you've got to the point where you're telling them and you go, now you're hiding it from us. You really know, but now you're not telling us. And this creates a lack of trust. And so part of that thing about being able to think this through is about getting people from those different functions working with you on the plan around raising awareness, building the desire for it, This is about the vision for the future. How do we create a future which is better for patients, better for staff, that creates an outcome that's going to add value in the long run? It might be a painful process to go on, but it's going to make a difference. Just bear with us and come on this journey with us. And that's building that desire to say, okay, yeah, it might not be the best thing for me in terms of, I've got to change what I do. But if it's the right thing for the patients, if it's the right thing for the organisation or the sector as a whole, it's going to keep the NHS running for future generations. Okay, I'm going to buy into that. And that's the thing that we need to get people to, is thinking about that vision about why it adds value, why it makes a difference. Knowledge, understanding what's going to happen, what's going to change, what do they need to know about it, and getting them involved in that design and engagement and process. Ability, that's building the skills. So it's not just knowing what you need to do, but it's actually that, like learning to drive to your new destination, or learning to drive. You have to build the skills to be able to do it. And it's about making sure you've got sufficient time and investment in to make sure that everybody knows what they need to do and how they need to do it, so that they are confident that they are doing it and doing it the right way. One of the things that we consistently see is that a new process, new way of working gets put into place and people twang back to their old ways of working. And part of that twanging back to your old ways of working is because actually they're not really clear about how to do some of this stuff. It's not familiar. They can't remember. They weren't sure how to log in the first place. You go, well, I haven't got time. I'm just going to work around it for now. I'll do it the old way and then I'll update it later. And suddenly you then got dual operating, where you've got two lots of things going on. And that's the worst thing that can happen, because not only have you got the old thing happening, that now they love it because they hate the new thing, because it's uncomfortable and they don't get it and it's complicated and difficult, and therefore, God, they hate that new thing. Why can't we continue with the old way of working? But also, it is not doing what they need it to do. So this is really important, about investing time and effort in building that ability. And then the final bit is the reinforcement, and it comes back to that old dogs and new tricks thing. Everybody needs to build new neural pathways to be able to do the thing that you want them to do on autopilot. They don't even think about it. They just do it now because they've done it so many times that it becomes the new norm. They're quick, they're fast, they're consistent with it because it's autopilot. They've built that new, stronger neural pathway. But that takes time and effort, and that requires you to really invest time and effort to get them to that place. And this is why the importance about climbing the mountain and planning the journey down again is so important. Because if you've only planned the time and money and effort to get to the top of the mountain, and not all of the time and effort to get it down again and safely, you're not going to deliver these outcomes, and you're not going to have that new norm working. And then the patients and the services and the staff are not going to benefit from it. It's just going to make it more difficult and complicated. So this is why this model and investing time and effort in all of those areas is really important. There's also thinking about the different lenses of how you go about planning for some of this change. Now, this comes from the government's project route map, setting up projects for the success. And this is about getting people to think about what are some of the things that we need to consider when we're looking at planning change. Because let's be honest, when we plan change, it's generally planned from the area that has the thing that you need to do. And if you've got a new IT system to, let's say, or EPR, patient records, it gets given to the IT team to deliver. But actually, the IT bit is probably the easiest bit. The changing the processes, the changing the ways of working, the changing the who does what and when, and the learning how to deliver services is probably the most complex bit. But because it's given to the IT team to do, they don't think about the people side of the change necessarily. So one of the things to think about is, what are the areas you need to cover? What are the benefits and the outcomes? And therefore, has everybody got a clear understanding of where you're trying to get to and why? The people and skills needed to both be involved with it and deliver it at the end. Behaviour and cultures. How do we need to learn to do things differently? And economic, environmental, and social value. And what difference does this make? What impact is this going to have? Do we understand this as a positive or a negative impact? How have we factored that in? Digital and technology, yes, that's usually the one we look at, but actually it should be there to enable us to work more effectively. It shouldn't be the thing that's driving it. The last thing is transitions, and have we planned this effectively? Have we got that timescales, the infrastructure, the environment correct in order to move with this going forward? So those are some areas to consider when you're thinking about complex change, and also the different elements to look into it. So we're going to have a Q&A in a minute, but I just wanted to kind of recap a little bit of the content that we've looked at today. So building your team capability by using neuroscience and project and change skills to get them ready and the organization ready for that change. That's about building that coalition of the willing, so getting people involved in creating that shared vision and clearly articulating the destination so that they can help take people on that journey with you. Creating the right environment for success so that you've got that psychological safety and the trust and openness. Engaging commitment by creating that space for people to engage with the change. If you don't create that space, it is just an added burden, and it's going to become an additional stressor. So if you don't ensure that there's capacity and support to enable people and free them up to engage in the change, it's going to make it more difficult for them. And flexing and adapting to meet complex and volatile changes. Everything we do and the people that we work with, it's a complex ecosystem. So we need to be mindful of that and listen to what's going on and adapt and change as we go. And it requires a collaborative, networked approach, because when things are changing and they're changing fast, if things are happening in different areas that you need to know, you need to bring people together to be able to share that learning. Okay, that is a summary of an intro into how to be a pirate ninja in managing change, and understanding a little bit about why neuroscience is so important in that space, to understand how to engage with people in a positive way, to take them on the journey so that we can deliver some of the outcomes that we're here to do. If anybody's interested in learning more, there's a whole bunch of reading and links that if people want to explore that further. As I said, we do some training, and I'm going to talk about that in a little bit. But also, I want to know if there's any questions. So does anybody have any questions for me? I should have said that at the start. Make sure you get your questions either in the Q&A, or if you want to stick them in the chat. And if you're very brave, stick your hand up and ask the question. Is this new? Is this familiar? Is this something that you resonate with? Does it jar with you? What's your thinking? Put your thoughts in the chat if you don't want to share, but I'd be really interested to hear what people's thoughts are on this and how this could be used effectively, or we could adapt it. Julie.
Of course, I was waiting to give other people the opportunity, Jo, but
you've got to lead the way, Julie. They'll follow.
Thank you. A great session. As you know, I absolutely buy into everything you've been talking about, and I just think it was a really great way of pulling lots of things together and making it real. So thank you. That was my only comment.
That's great. And if anybody doesn't know, Julie leads some brilliant training on change management that we provide through the association. There's also the change management toolkit, so that will help you to get structured and plan and organize your change. But also, if you're not a change manager and you want to develop and learn about it, there is a change management community of practice. And we can connect you in with people who are leading on change and also get involved in change. We have some free online learning for newbies, so a great place to start to build your change management journey. We've got a couple of comments in the chat. I'll just kind of dip into those. So Samantha, I love the ideas, but do wonder what I can practically do as a clinical leader to get my colleagues into the right headspace for change when we're so stressed in our clinical capacity. Yeah, absolutely right. It is a really difficult challenge. And I think it's one of those things where, as a starting point, if you think about what we have in terms of availability of learning and development, we have some core skills online learning just in terms of getting people engaged in understanding that change management is a thing, and that to take people with us is going to make life easier in the long run. There isn't an easy answer, I'll be honest, Samantha, in terms of that clinical capacity, but there's something about what can the organisation do potentially in terms of being able to put some time aside or provide some capacity. If we don't do this, what's the impact? And we've looked at the way in which the NHS has continued to struggle post-COVID. We haven't got the money, we haven't got the resources, we're struggling to recruit, we're struggling to retain. What have we got that we can use? And I think some of it's about what can I use in a small amount of time and chunk it up. Our online learning module on change management is 40 minutes. It might be that you share something which is actually, are you aware that this exists? Is there something that we can put on that will engage clinicians and say, you know, we can do a session for them that says, actually, have you heard about this? This is something that will be really valuable to you. And make it short and bite-sized so that they're not having to invest a lot of time and effort in it. I think that applies to everybody, but particularly the clinicians. Says, could you please expand on the Change Ninja approach? We probably haven't got time to go into that today, but what I can do is I can signpost you to Dr. Tammy Watchhorn's website, but also we run the Change Ninja training. So if you have a look at both her website to find out more about it, but also buy the book. It's not very expensive and it's really good fun and really insightful. So I think that's a good starting point. We've also got some previous sessions that we've probably got on our YouTube channel that might cover a bit more about that as well. So we'll signpost that to you. Gavin's put, seems to me that readiness for change at an individual, group and organisational level are key. Absolutely, I'd agree completely, Gavin. And very little time and effort is usually put into that. You know, a decision's made, it's like, right, get on and do. And you go, but what do we need to have in place in order for it to land? Getting that firm foundation right in terms of the ability and capacity and, you know, planning around it is really critical. And particularly the organisational culture and behaviours. If you don't look at that before you do a complex change, you're going to get what you already had. And if it wasn't in a good place, you're going to get new ways of working, but with the same bad, you know, bad culture and behaviours that go with it. Some of that needs to be focused on and be honest and open about it. Peter, do you want to come in? You got a question?
Unadulterated plug for Wednesday in terms of readiness.
Absolutely.
Because
Excellent.
that's about the quality of relationships. And we can sort of assume that a transactional sort of top-down project management delivery structure, etc., you know, Prince black belts can always deliver change, but if you don't trust people or respect them or understand them, etc. So little plug for Wednesday.
Absolutely. We will come back to that in just 1 minute, because this is part of a series of sessions that are all kind of connect together to provide different resources and supports to you and your organisations to be able to lead and deliver on some of this change more effectively. Natalie's put in about a great session, focus on various positive features of pirates, however they had many negatives. Is there any relevance to the reflections and to the concept for our purposes? I was very careful to mention the golden age of piracy, Natalie, and whilst we kind of think of pirates as being very brutal or very comedic if you think of Johnny Depp, the pirates were actually no more brutal than the Navy was. Everybody was brutal at that time. It was not a time to be living in at any stretch. So I don't think they were worse than anybody else. It's just that, you know, who told the story? Well, actually, you know, the Navy told the stories because they got to print the official versions. And so therefore it kind of gave pirates a bad rep. But yes, just be grateful we live now and there's a little less bloodthirsty violence going on. Well, a little less anyway. But yeah, it's interesting, but I really recommend reading Be More Pirate, because it gives some really fantastic insights, but also it looks at how we can use the sort of mindset about bringing people together in terms of collaboration in the way that we work and behave and think now. And it's really good for communities, relationship building, how we can get people thinking about things in a different way and working collaboratively on a solution. So just take the good stuff, you know, none of the cutthroat slaughtering, and, you know, we won't cover that bit. So just mindful of the time, and there may be a couple of other questions or comments, but what I will do is if there's anything that need to come back to, I will do on that session.